in Sagaing, surrounded by many buildings, completely destroyed. The level of destruction in the city is absolutely massive. About 80% of the buildings in Sagaing have been destroyed by the earthquake. It is in this context that UNFPA ramped up its presence in this location in Sagaing City, and we are already delivering services for the women and girls in Sagaing. Indeed, in 24 hours since the country was hit by the earthquake, we were present with our partners delivering reproductive health services, maternal health services, and setting up the systems so we could protect the women and girls from gender-based violence. The example that I have behind me is just one of the many buildings that I've seen destroyed. There are no health centers. Just try to put yourself on the shoes of a pregnant woman, a woman that requires obstetric care. What kind of services is she going to get? There are no facilities. It's very difficult to move around in the city, not to mention the trauma they've been through because of the earthquake. Many of them are overworked, are not eating properly, they have probably a deficit in terms of their nutritional status. They are at a higher risk of having anemia, of developing complications, and they need access to reproductive health services. Those services are life-saving. Right now in Sagaing, we are operating with one static clinic and 3 mobile teams that are going around the city and providing those services wherever there are women who require those services. We are present. We have teams on the ground, we have partners on the ground, and we have delivered more than 5,000 dignity kits, women essential items, and clean delivery kits to women and girls in Sagaing as well as in Mandalay. I'm in Mandalay, one of the cities that was most affected by the earthquake that hit Myanmar on the 28th of March. What I have behind is one example of the destruction, the massive destruction that the earthquake caused to the city of Mandalay and the neighboring Sagaing. From the very first moment when the earthquake hit the country, UNFPA delivered a rapid response team to Mandalay and to Sagaing. With partners, we've been able to set up services that look after the situation of women and girls, in particular with the deployment of reproductive health services that can save the lives of pregnant women. We see a building that collapsed. We don't want the lives of those women and girls to collapse as well. We have a total of 2 static clinics, 3 mobile teams that are moving around the city and providing services to women who require those life-saving sexual and reproductive health services. But not only that, we are also with teams providing mental health and psychosocial support to overcome the trauma that those women and those girls have suffered because of the earthquake, and we are also providing protection services for those who may be exposed to gender-based violence. UNFPA is in full force trying to assist the victims. We've been here, as I said before, from the very first moment, deploying our teams, deploying our supplies, but we need more support. We need more support so we can continue sustaining these interventions over time. Let's not forget, in 1 month, there will be the monsoon, the rain will start, and we need to make sure that the current services, life-saving services that we are providing right now, can be sustained over time, and that those women, those girls, can have access to good quality reproductive health services and protection services when the moment comes, when the rain starts, and we are going to see really and truly this situation being even further aggravated by the rain.